live from Washington. Figures show that transit workers are dying at an alarming rate across the country from COVID-19. Hundreds of workers who still operate bus, subway, and streetcar systems amid the pandemic have in recent weeks tested positive for the virus. Now, the problem has been especially bad in New York City, where already 10 transit workers have died. Now, two unions representing the overwhelming majority of transit workers in the United States are demanding better protection for their workers. Joining us now is John Costa, president of the Amalgamated Transit Union International. It's the largest labor union representing transit and allied workers in the United States and Canada. Thank you so much for joining us. Help contextualize this for our viewers and for the American people. How big has this problem become for transit workers across the U.S. and Canada?
Thank you, Tim, for having me on. It's huge in the situation. Every day our members are going out there, not only on for the ATU, but the TWU and other transit workers throughout the country with the fear of this virus spreading. And obviously, we seem to be the highest numbers of infections that we're seeing, and that's as far as transit workers. So it's obviously spreading, and we're being very exposed to this without the proper equipment.
Well, let's talk about that proper equipment. What are you demanding right now? Describe the conditions that these workers are undergoing, and what do you want to see from the organizations where these workers work?
Well, unfortunately, we're not first responders. They're recognizing us as essential employees, so we're not even on the list for the proper PPEs. What we are requesting is that we have the proper masks, gloves, disinfecting the buses in our maintenance area, and the protective equipment for our maintenance also. And our bus drivers, the overcrowding has to stop. There's too much overcrowding, and we believe that also the public, the riders should be wearing masks before they come on the buses, and if they don't have a mask, they don't ride.
There's this fundamental tension here, right? Because we've seen, at least in New York City, where I can speak to what I've learned from friends who are currently there, and from what I've read, we've seen that they've cut service for buses and for subways in order to save money because demand is down so significantly. But what that has resulted in is overcrowding on the buses and trains that are running. So what do you want to see these cities do, given how strapped they are, not only for cash, but for workers as well?
Well, Tim, exactly. That's one of the problems we're having. By cutting service, there's more overcrowding. There's nobody out there to separate or allow so many people on a bus before the bus moves out. The stimulus money that came in has doubled their funding. So they have the money for the protective equipment. They have the money to keep the service going. So that's a false. It isn't a money issue. And like in New Jersey, Governor Murphy has kept service going. Unlike New York, they're not cutting the service as much. There might be some service down as far as members out sick or quarantined, but that service is continuing. And he has actually did an executive order over the weekend that mandated all the demands that we were requesting.
So, John, we talk a lot about workers on the front lines, and I think people refer to healthcare workers significantly when they're talking about workers on the front lines, but no question that transit workers are absolutely on the front lines. In New York City, where reports say that the death rate for transit workers appears to be exceeding that of emergency medical services at the FDNY, what specifically is the MTA doing to protect its transit workers, and why is that not going far enough?
I believe the governor now has also did an executive order requesting the PPEs and masks, not as to the extent of the New Jersey Governor Murphy. I think he was the first that actually put all the demands there, and that will be going into effect. Listen, this is a terrible situation. We are the highest. I believe we have over 6,000 of our members between the TWU and ATU, John Samuelson's members, in quarantine. We have over 2,000 that are tested positive, and we have many in the hospital, and I think we're at maybe 40 that are now have passed. So it is obvious that we're being overexposed on the buses and trains, different than the other responders are essential workers. We cannot work from home, so we're out there, as you know, just being exposed. And I think we're overexposed, and the masks were a little too late. They said, at first we didn't need the mask. Obviously, we did.
Look, and you can't work from home, and look, we can't work without you. So we certainly appreciate, and that does not fall on people who don't understand that. I think it's so important to understand that it's not just the workers on healthcare and emergency first responders who are on the front lines, but those people who get those people to work, John. A big thank you to John Costa, president of the Amalgamated Transit Union International. Thanks for taking the time this morning.
Thank you, Tim. Be safe.